Namaskar. October 21 will go down as a red-letter day in the history of our country, the day on which India achieved a cumulative vaccine administration count of 1 billion against COVID-19. The Prime Minister credited the achievement to the triumph of Indian science, enterprise and the collective spirit of 130 crore Indians. That's our focus tonight. Let's begin with the headlines. My name is Mark Lynn. India achieves the landmark milestone of 100 crore vaccinations in a record 9 months. Prime Minister congratulates India on crossing the landmark figure and says that the nation now has a strong protective shield of 100 crore vaccine doses to counter the worst pandemic in 100 years. Prime Minister Narendra Modi witnesses inoculation at RML Hospital in Delhi, interacts with COVID warriors, from the data entry operator to the security guard and nursing assistants to beneficiaries. Everyone gets the thumbs up from Prime Minister. President, Vice President, Union Ministers also expressed gratitude to doctors, nurses and all those who worked to achieve this feat. The Union Health Minister participates in a display of the world's largest national flag. The majestic tricolour on the Red Fort will symbolize self-reliant India. Leaders from across the world and the medical fraternity congratulate India. Prime Ministers of Bhutan, Sri Lanka, Israel, President of Maldives, US Secretary of State Anthony Blinken, the DG of the World Health Organization, they all hail the achievement. Following the Moscow meet on Afghanistan, the UN sets up special trust fund to provide urgently needed cash to Afghans. Germany is the first off the block, pledging over $58 million to the fund. Prime Minister Narendra Modi inaugurates the Infosys Foundation's 806-bed Vishram Sadan at the National Cancer Institute in Jhajjar campus of AIIMS, New Delhi, and hails the contribution of India's corporate sector, private sector and social organizations in strengthening the health services of the country. Cabinet nod to Mission Gati Shakti in a Diwali gift for 47.14 lakh central government employees and 68.62 lakh pensioners. The Cabinet approves the increase of 3% of dearness allowance. Union Home Minister Amit Shah conducts aerial survey of flood-affected areas along with Governor Gurmeet Singh and Chief Minister Pushkar Dhami in Uttarakhand. The death toll crosses 60. 17 teams of NDRF, 60 of SDRF and 15 teams of PAC and over 5,000 security forces deployed for relief and rescue operations. Orange alert for 8 districts of Kerala remains in place. Our top story: India has attained a historic milestone in the fight against COVID-19. The country has administered over 100 crore vaccine doses across the country since the middle of January. And Prime Minister Narendra Modi lauded the efforts of science, enterprise and the collective spirit of the nation. The Prime Minister visited the Ram Manohar Lohia Hospital in Delhi and interacted with the staff involved with the vaccination drive. The Prime Minister said the vaccine has brought pride and protection to our country. Here's our report.
भारत का टीकाकरण लिख रहा एक नया इतिहास है।
And with this, India achieved the landmark figure of 1 billion vaccinations, an achievement that most of the world, including developed nations, find unimaginable. The most effective weapon in the battle against coronavirus is history in a record 9 months under the leadership of Prime Minister Narendra Modi. Congratulating the nation, Prime Minister said that India now has the armour of 1 billion vaccinated citizens to fend off the worst pandemic to grip the world in 100 years.
100 साल में आई सबसे बड़ी महामारी का मुकाबला करने के लिए देश के पास अब 100 करोड़ वैक्सीन डोज का मजबूत सुरक्षा कवच है। ये उपलब्धि भारत की है, भारत के प्रत्येक नागरिक की है। मैं देश की वैक्सीन मैन्युफैक्चरिंग कंपनियां, वैक्सीन ट्रांसपोर्टेशन में जुड़े कर्मयोगियां, वैक्सीन लगाने में जुटे हेल्थ सेक्टर के प्रोफेशनल्स, सभी का खुले मन से, हृदय से बहुत बहुत आभार व्यक्त करता हूं।
The Prime Minister visited the Ram Manohar Lohia Hospital in the national capital to boost the morale of health workers and interacted with the people who came for vaccination. He also went around the vaccination centre. Prime Minister interacted with Divyang Arun Rai.
मेरा ये पहला डोज है।
अरे इतना देर लगा दिया?
इसलिए कि अभी तक लापरवाह था और मैं ये सोच रहा था कि क्योंकि मैं बनारसी हूँ
बनारस के एमपी ने लगवाया तब मन नहीं कर गया।
आपने पहले लोग समाज में विकलांग शब्द जब कहते थे तो बड़ा मन में कष्ट होता था और अपमान महसूस होता था, लेकिन आपने दिव्यांग नाम दे करके हम लोगों को बड़ा दिव्यांग बना दिया।
Prime Minister also interacted with nursing officer Christina from Manipur. He inquired about the challenges they face in carrying out their duties.
अब तक कितने लोगों का वैक्सीन किया?
सर, जब से वैक्सीनेशन शुरू किया था मेरा ड्यूटी आ गया था तो लगभग सर
15,000। अरे वाह
सर, मुझे बहुत अच्छा लगा कि
तो अभी तो कॉन्फिडेंस लेवल भी बहुत आया होगा।
हाँ जी सर।
चलिए बहुत बहुत बधाई आपको।
In an endearing moment, a young girl who had come for her vaccination sang an inspirational number while interacting with the Prime Minister.
गाना गा
गाना गाती, अच्छा ही सुनाओ, देशभक्ति का कोई गाना सुनाओ।
मेरे वतन के लोगों जरा घूम लो पानी जो शहीद हुए उनकी जरा याद करो कुर्बान।
The security guard at the hospital thanked the Prime Minister for raising their morale with his Main Chaukidar who called.
सबसे बड़ी बात सर जैसे आपने कहा ना कि मैं देश का चौकीदार, तो वो चीज़ बड़ा गौरव है सर। देखिए बहुत गौरव है देश के जितने भी हमारे सिक्योरिटी के लोग हैं, सब लोगों का आपने गौरव बढ़ा दिया सर।
Prime Minister Narendra Modi's interactions covered every corona warrior who are a part of the vaccination chain, and these corona warriors expressed their elation at meeting the Prime Minister.
आज 100 करोड़ हो जाएगा वैक्सीन के लिए, तो इतना मतलब अच्छा फील हुआ उनको कि हमें वैक्सीन, हमें उसको अच्छे से गाइड किया हमने कि हमें वैक्सीन लगवा के आपको पूरे देश की आर्थिक स्थिति को हमें ठीक करना चाहिए और हमें आने वाले वायरस को फैलने से रोकना चाहिए।
उन्होंने पूछा कि कोविड के टाइम में आपने कैसे ड्यूटी की, आपके घर वाले आपको मना करते रहे होंगे, तो मैंने कहा सर मना तो करते थे, लेकिन मन में एक सेवा का भाव था कि जब हमारे देश के प्रधानमंत्री लगे हुए हैं सेवा में तो हम क्यों नहीं कर सकते हैं।
The vaccination drive began on 16th of January 2021 and on the very first day over 91,000 doses were administered. The second phase started on the 2nd of February 2021 covering frontline workers. The third phase of immunization began on the 1st of March 2021 to include those between 60 years and 45 years of age as well as those with comorbidities. The Prime Minister also took the jab on the same day. To further boost the coverage, all people above the age of 45 were included in the campaign from April 1st. The nation began administering the doses for people above the age of 18 from 1st of May. The journey, which began 9 months ago, witnessed achievements on several fronts. The target of 100% vaccination of at least the first dose remains in sight, with the pace of vaccination increasing over time. Bureau Report, DD India.
Well, the historic moment has been etched in history, and to mark the occasion, the national flag, the largest of its kind in the world, was unfurled at Red Fort. The nation's salute to the efforts of all those who made this achievement possible. Here's our report.
The majestic tricolour on Red Fort is the world's largest national flag. It is symbolic of a monumental achievement. 100 crore vaccine doses administered across the length and breadth of the country. A proud moment indeed for the country's national flag to fly high. It is 225 feet long, 150 feet wide and weighs 1400 kilograms. The flag was put together by 70 artists in 9 days. Union Health Minister Mansukh Mandviya was present on the occasion. He released a song on the occasion sung by singer Kailash Kher and an audio-visual film. The minister highlighted the drive as an affirmation of people's trust. The vaccines are made in India and hence a celebration of self-reliance, a Diwali of self-reliant India.
यह उपलब्धि समर्थ नेतृत्व की निशानी है। ये उपलब्धि मोदी जी के संकल्प की कहानी है। ये उपलब्धि देशवासियों की विश्वास की अनुभूति है। ये उपलब्धि आत्मनिर्भर भारत की दिवाली।
Mandviya visited the COVID-19 war room in Delhi and interacted with employees, acknowledging the sweet success with sweets. This unprecedented achievement is being celebrated across the country through rangolis and distribution of sweets. The Health Ministry shared a video marking the historic day. President Ramnath Kovind congratulated the nation.
आज एक इतिहास रचा गया। सभी देशवासियों ने मिलकर के जो हमारा 100 करोड़ का वैक्सीनेशन था उसको हम पार कर गए।
Vice President M. Venkaiah Naidu acknowledged the dedication and hard work of all frontline and healthcare workers, scientists, vaccine manufacturers and the central and state governments.
हमारा कोरोना वर्कर्स के जितनी तारीफ की जाए उतनी ही कम है और दिन रात मेहनत करके देश के कोने-कोने तक वैक्सीन पहुंचा रहा है। मेरी अपील है कि वैक्सीन लगवाने को आप लोग आगे आइए।
Members of the Union Cabinet praised the astute leadership of Prime Minister Narendra Modi while congratulating the country on this historic achievement.
प्रधानमंत्री श्री नरेंद्र मोदी जी के नेतृत्व में इतने कम समय में 100 करोड़ वैक्सीनेशन डोज देने के लक्ष्य को प्राप्त करके भारत ने अपनी संकल्प शक्ति का परिचय दिया है।
दुनिया के जो बड़े बड़े देश हैं जिनकी हेल्थ केयर सिस्टम्स बहुत अच्छे हैं, उनसे भी बेहतर तरीके से भारत ने प्रधानमंत्री जी के नेतृत्व में देश भर में व्यापक रूप से वैक्सीनेशन किया। तो उसी संकल्प का एक बहुत बड़ा महत्वपूर्ण आज पड़ाव है
कि देश की एक उपलब्धि है। देश के सभी नागरिकों का आभार भी प्रकट करता हूं। वहीं पर माननीय प्रधानमंत्री जी के नेतृत्व में जिस तरह से वैक्सीन मैन्युफैक्चरिंग से लेकर वैक्सीनेशन कराने तक का ये दौर चला है, इसमें सभी कोविड वॉरियर्स का, हेल्थ वर्कर्स का और सभी इस मुहिम से जुड़े हुए लोगों का आभार प्रकट करता हूं।
BJP National President JP Nadda said the achievement reflects the government's commitment to the health security of every person in the country.
भारत ने 10 माह से कम समय में 100 करोड़ कोविड वैक्सीनेशन के लक्ष्य को प्राप्त किया है। यह स्वास्थ्य के क्षेत्र में अभूतपूर्व उपलब्धि होने के साथ साथ विश्व के पटल पर भारत के सामर्थ्य का प्रतीक है।
Uttar Pradesh Chief Minister Yogi Adityanath visited Saraswati Shishu Mandir in Lucknow and took stock of the vaccination drive. He honored healthcare workers for the human efforts. Chief Ministers of all states have congratulated the nation on this achievement.
उन सबको इस अवसर पर बधाई देता हूं। प्रधानमंत्री मोदी जी का, सभी हेल्थ वर्कर्स का, कोरोना वॉरियर्स का हृदय से अभिनंदन करता हूं।
ये जिंदगी के डोज देने के लिए प्रधानमंत्री श्रीमान नरेंद्र मोदी जी का जितना अभिनंदन किया जाए उतना कम है।
मैं अभिनंदन करता हूं उन फ्रंटलाइन वॉरियर्स का जिन्होंने कोविड-19 के पैंडेमिक के वक्त काम किया और डोज एडमिनिस्ट्रेशन करने में हर पूरे देश में हर राज्य में दिन रात मेहनत करके लोगों को डोज लगाया।
All senior officials associated with the health sector have in one voice hailed the mammoth achievement.
Truly well deserved, because to reach 1 billion dose mark for any nation is remarkable.
The complete energy of all the healthcare professionals, the scientific community, the ministry, the Niti Aayog, the NEGVAC, COVIN, ICMR, and all who have worked in a whole of government approach to get this vaccination drive.
Every Indian should be proud of this achievement, because this is something which the world didn't think India could achieve. There were a lot of people who were skeptical when we started the vaccine drive in January.
Huge congratulations to India for marking yet another milestone, 1 billion COVID-19 vaccine doses administered.
It is clear that this achievement of the country stands head and shoulders above many a triumph. But while it is a huge milestone, the war of COVID continues. The time has come for those still not vaccinated to come forward and get the job done. With Nitendra Singh, Bureau Report, DD India.
Well, congratulations have also come in from across the world, and let's take a look at some of the important tweets that have come in. The Prime Minister of Israel, the Israeli Prime Minister Naftali Bennett, congratulated Prime Minister Narendra Modi and on leading India's successful COVID-19 vaccination campaign. And he said that it's now achieved more than 1 billion vaccine doses to the people of India. And he said that this is life-saving, these vaccines, and they are helping all of us, not just India, all of us defeat the global pandemic. Moving on then to the next important tweet. This is from the Prime Minister of Bhutan, Lothe Tshering, and he called it a huge accomplishment not just for India but the world. And he congratulated Prime Minister Narendra Modi and India on behalf of the people of Bhutan. Moving on to the next one, and this one is from the Prime Minister of Sri Lanka, Mahinda Rajapaksa, congratulating Prime Minister Narendra Modi and the medical community of India for achieving this mammoth task. He also put the vaccination drive at the center of adjusting to a new normal, which is essential for everyone in this world. The next important tweet is from, again, from our neighborhood. The President of Maldives, President Soleh, has said that he's congratulated Prime Minister Narendra Modi and the government of India, and he said that this achievement, in fact, has displayed the innovation and the solidarity of Indian people. He thanked India for supporting the Maldives to recover from COVID-19. So India is contributing in their vaccines as well. President Wavel Ramkalawan of the Seychelles, in a statement, he called it a significant achievement in a relatively short span of time. We must remember 9 months. And he hailed Prime Minister Modi's leadership. He said that he had no doubt that India will now achieve its target of inoculating its entire adult population by the end of 2021. So it's a rather lengthy statement, but that was the gist of it. And Dr. Tedros, who is the Director General of the WHO, congratulated the Prime Minister, also scientists and health workers, and the people of India for protecting vulnerable populations and achieving vaccine equity targets. So this is an important aspect of vaccine equity and protection of vulnerable populations. The U.S. Secretary of State Anthony Blinken congratulated India for the extraordinary accomplishment, and he applauded India's success at home and efforts to help end this pandemic in the Indo-Pacific region and beyond. This is a major endorsement of India's global role. Ambassador Lindner of Germany has exclaimed that 1 billion vaccinations, you know, he's put 2 exclamation marks there. He said what an enormous effort, and has given his deepest admiration for all the healthcare workers and staff. He calls them countless heroes and heroines. UNICEF, in a statement, has called it a tremendous achievement given its logistical complexity, and he observed that as families recover from COVID-19, the milestone remains. That was UNICEF, and this is the president of Malawi, in fact, that we are showing you, has also congratulated India and highlighted the importance of vaccine accessibility to building back better and stronger. That's an important aspect, and Prime Minister has replied to this and thanked him for his tweet, and he said that we are in it together. That is accessibility and building back better. So that brings us to In Focus tonight, and we are going to be focusing on this subject. In Focus is 100 crore jabs, hashtag vaccine century. Hashtag vaccine century. And to discuss this, we have with us, we're joined by Dr. V.K. Paul, member Niti Aayog, and Dr. Sanjeev Sinha, Professor, Department of Medicine at AIIMS. Thank you very much, gentlemen, for being with us. Dr. V.K. Paul, of course, has played a very significant role in India's COVID role. I mean, he was the chairman of the task force. Dr. V.K. Paul, how would you look at this? This is a huge achievement, would you say? I mean, it's an achievement of a self-reliant India?
Absolutely. It is an achievement of historic proportion. 21st October 2021 will be remembered as a remarkable day in the history of India's endeavor for self-reliance, India's endeavor for providing health security in the face of an unusual and unprecedented, devastating pandemic. And it is also a landmark, a day on which the leadership of the Honorable Prime Minister has shown us what India can achieve on such a scale for such a very major challenge that we all are facing.
Indeed, Dr. Sinha, but going forward now, you know that we haven't yet vaccinated children, so you know the task is still cut out for us. How do you see us, you know, proceeding? Because as you know, one of the international you know, leaders had said, really, I mean, this is to deal with the new normal. It's also essential about accessibility so that other countries can have it. Sir, we can't hear you. I think maybe you're mute. You're mute. Mute.
So first of all, I would like to congratulate everyone through you, and it's a great achievement for country. And today we are celebrating. It's a big day for everyone, and we are happy that today 100 crore vaccine doses completed, and it takes about more than 9 months to complete 1 billion doses for the COVID vaccine. So it's a very great achievement for country, and it's a huge efforts made by scientists, doctors, frontline workers, Niti Aayog, Ministry of Health and Family Welfare, AIIMS, and manufacturer and politician and policymakers. So I think it's a great achievement for country. So regarding your question for children, so I would like to tell here that we have already, India have already done the phase 3 trial for children aged between 2 to 18 years of age, and data has been submitted to DCGI, and subject expert committee have already cleared this, and the matter is with DCGI. So hopefully very soon we'll have vaccine for children also, and we already have one vaccine, Jago DV, in our country that we can give more than 12 years of age. So there is already vaccine for children in our country, and we have Covishield and Covaxin for adults, and we have other vaccine like Sputnik, and DCGI have given the permission to some more foreign vaccines
indeed.
For use in India.
Dr. Paul, Psychov-D in fact is a DNA vaccine, so that is it's the first of its kind in the entire world also, and it's you know, experts are saying that this is the future of vaccinations in the world. So India, of course, is already showing the way, not only in vaccine production with you know, I mean, all this was Atmanirbhar, but really vaccinations for the world going forward.
It is true because the portfolio of vaccine from different platforms is perhaps the most comprehensive in our nation. Nobody else has such a large portfolio. So let me elaborate on this very briefly. We have the inactivated virus vaccine, Covaxin. We have the vector vaccine, which is Covishield, the mainstay vaccine. These both put together for our own national program. But going forward, we also have Sputnik, which is another vaccine being manufactured in India with the support of tech transfer from Russia. We have a DNA vaccine, the world's first DNA vaccine for human use, very much homegrown, very much made in India, developed in India vaccine. Going forward, we have biological E vaccine, which is a protein subunit vaccine. It's a different platform. And that would be available in very large quantities because they have tremendous capacity to manufacture. Going further forward, we have an mRNA vaccine from Genova, which very, very uniquely is thermostable in the normal cold chain condition, not like -70 that Moderna and the Pfizer vaccines require. So fascinating opportunity there for us and for the world. And then going further forward, we also have the intranasal vaccine, which perhaps will be very, very unique vaccine to stem the spread of the disease. So look at the spectrum. And then in addition, India is manufacturing J&J vaccine also in the country. It will be largely for export under the Quad and COVAX arrangement. But this kind of a plethora of options available for different platforms, no other nation has it. Nobody is close to it. And, other nations, would look up to us. And therefore, not only what we have done today is critical, but going forward, for our own selves, if we have to be using vaccine for children, or if perhaps someday need for any booster, be taken care of. But today the priority is to vaccinate the adult population. I think that is the message I would like to give to your viewers, to Indian viewers, that today the priority is that we get into our fold those who have not received the first dose, and these are 25% of our adult people, and they should know that having given 100 crore doses, we know these vaccines are safe and effective and have been embraced by everybody. So कोई पीछे रहना नहीं चाहिए, जिसको पहली डोज भी नहीं मिली, उसको हमें ढूंढ के, रिक्वेस्ट करके, विनती करके, फैसिलिटेट करके इस प्रोग्राम के साथ जोड़ना है. And then there are people whose second dose is due, and everybody must take the second dose for full effectiveness, and we want to get them on board. So the first and the foremost priority is vaccinate all adults, and that provides protection for children, that provides protection to the nation as a whole against the effects of the pandemic. Going forward, there will be plenty of vaccine after our needs have been fulfilled for the humanity.
Dr. Sinha, of course, we are looking at the speed. In 9 months' time, this entire process has taken place. And, in the days gone by, it took about 8 years, first of all, to, to give approval for a vaccination. So, of course, these are all under emergency situations. But the fact that India has risen to the occasion and delivered like this, protecting the adult population, it sends out a very important message because India is an emerging power. It's also a country which, as Dr. Tedros said, there is where you're providing for vaccine equity in a sense, because you're providing for marginalized people, for people who would not have access to these vaccines. These are important messages that are going across. So what would you say about vaccine equity?
So one thing I would like to tell, that you can see we have made in India vaccine, like Covaxin is totally made in India. And then Covishield, we have got the technology from Oxford and AstraZeneca, but it was made in India, in Serum Institute of India. So, and then other vaccine, as Professor Paul said about the Jaiko VD vaccine, and we have some more vaccine like mRNA vaccine is also coming up. So you can see that it's a big effort by country. And we are self-dependent. We are not dependent on the other person. And today we have achieved the 1 billion doses. So that's a big achievement for the country. And one more thing I would like to add about nasal vaccine, that this vaccine trial is going on in a different part of country, and AIMS is also one of the center for nasal vaccine. So this is a kind of phase 2 trial, and it is given through nose, through nostril, and it's a very easy kind of route, and it can be given by any person. There is no need for a trained person. There is no need to give injection. So in the coming days, we will see once early next year we'll approve this vaccine. That is going to be very helpful for the country.
Dr. Paul, since we're, it's a global achievement in the sense, I mean, this is a statement to the rest of the world as well. We can see that a lot of praise has come in from various countries of the world, but there is also the question of protection of vulnerable populations. We have to protect the rest of the world as well. Otherwise, the world will not, COVID will not go away, and the African countries are concerned. So going forward, what do you see? I mean, in terms of vaccine Maitri and all these programs that India had started, how significant what sort of progress will be made in our vaccine diplomacy?
Well, once our own requirements have been met optimally, and we have secured vaccines for the target population that we have decided to cover on top priority. Once we have the Suraksha Chakra around us, yes, the stockpile and the production that's available is for the world. In a sustained manner, because after some time our own requirements will be very low, and we will have a huge capacity of various vaccines to which I referred to be made available to other countries, to other people. And from the very beginning, the Prime Minister has made it clear that our vaccine endeavor, vaccine capacities are not only for India, but for the entire humanity. And Vaccine Maitri is such an early course of our own vaccination program, sharing the most precious commodity of the day, namely the vaccine, with over 100 countries, was a conscious decision, a decision taken in the larger interest of the humanity. And indeed, when now our own requirements are well within our sight to be met, the spare supplies, additional supplies would be for the world. And that promise has been enunciated by our leadership, and going forward in a very balanced, a very calibrated way, this action will be translated into real delivery.
Dr. Paul, also with regard to booster shots, I mean, you did mention, many people have not taken their first doses, but there are some who don't take their second dose, and there are some who want to take, after taking their booster dose as well, looking to take some other form of vaccinations. So what would you say to, people who are either still hesitant or people who are over enthusiastic about vaccinations?
I think we should not at this moment be distracted by the need for the booster, or an eagerness to have the booster. Let's wait, because the very evidence and very scientific decision to have boosters has not been sorted out.
Okay.
Boosters may have to be given at different times, if at all, in different vaccines. This has to be based on systematic studies as to how the immunity lasts over a period of time. We have not sorted that out. It's a work in progress. Companies are doing it. Scientific community is doing this work. There is no uniform opinion, even in some nations where there has been more talk about booster doses. There is no universal recommendation by the World Health Organization. It doesn't mean there will be no need. No, the point is that the time for going in for booster dose is based on science for the vaccines that we have given has not yet come. It's work in progress. Our scientific groups, the NTEGI, is looking into this aspect. But importantly, the message should go that our priority is to first do things that are first priorities, namely vaccinate every adult.
Yes.
Every adult be vaccinated with 2 doses of the 2 great vaccines that have been made in India. The free vaccine,
Right.
95% of all the vaccine supplies are free, procured through central procurement of the government. And such a large free vaccination program is the achievement of the day. And we would like to see everybody who has not received the first dose to connect with the vaccination program.
Right.
We would like to see society, friends, neighbors, volunteers, panchayats helping identify such people, persuade them to come to
Right.
the vaccine centers, facilitate their coming to the centers, and take the first dose. Those who have taken the first dose, please take your second dose when it is due. You are not protected till you have received the second dose.
Yes.
One dose hardly protects you, and in a significant way. The immunity will wane off very soon. You have to take the second dose. इसकी आप लापरवाही मत करिए. आप ड्यू हैं, आपने तो पहला वैक्सीन ले लिया है, खुशी से लिया, मर्जी से लिया, आपने अच्छा डिसीजन लिया, लेकिन जब तक आप दूसरा डोज नहीं लेंगे, you are not fully protected. You are also then vulnerable in getting the transmission of infection through you to other people. So the biggest guarantee for our children, for our society, is to have a universal and a complete coverage of the adult population. They are the ones who are vulnerable. They are the ones who are likely to have serious disease. They are the ones who can have the ultimate bad consequence of the pandemic. So let's protect this nation by giving vaccine to every adult, for which now there's plenty of vaccine available.
A final word from you, Dr. Sinha, about the entire process, because of the logistics involved. This is itself a huge achievement. You've been involved with administering vaccinations yourselves. So to what extent, how easy did the CoWIN platform, the EVEN platform, all these platforms make this entire process? Otherwise, we may not have reached 100 crore so fast.
So I think you're correct. So I would like to say that everybody have to come forward and take the vaccine, both the doses of the vaccine, and we have to follow the appropriate COVID behavior. That is very important. We have to wear the mask, face mask. We have to take the proper social distancing, and we have to keep the hand hygiene and respiratory hygiene. So to end this pandemic, it is very important to take the vaccine and follow the appropriate COVID behavior. And as you said, that you can see that 1 billion doses has been delivered.
Yes.
And you can see there is 1 billion syringes, 1 billion needles have been required for this, and bottle has been required for injection material. So it's a big achievement, and it's a big achievement by everyone from country. And the CoWIN app is very helpful for this vaccine program. So I'll congratulate to every person who is involved.
True, it's been a tremendous example of management. A final word from you, Dr. Paul, because we still haven't got WHO approval for Covaxin, and that's something that after 1 billion doses of vaccines being delivered, surely this approval should come through fast.
Yes, it should come through fast. That's our expectation. We should respect the processes of World Health Organization. We are part of WHO.
Yes.
But yes, we believe that the Covaxin deserves the EUL, and we expect this to happen. And my last message is, even when you have taken both the doses, please, you will not give up wearing mask. You will not give up precautions that you must take by avoiding going to crowded places, going for parties, and going for celebration as mass gatherings. No, please celebrate this year's Diwali and Christmas and Eid in your own homes with the family. These precautions are still very critical. We cannot allow our current good situation of the pandemic being at such a low level to be frittered away. So on the one hand, embrace the vaccine, as I have stated, and on the other hand, during the next 3 months, let's be very, very pertinent in looking after ourselves with the second vaccine, the social vaccine, wearing a mask and protecting ourselves from crowded places and maintaining social distancing. This is still very, very essential. Very essential.
Thank you very much, Dr. V.K. Paul and Dr. Sanjeev Sinha. Thanks very much for your time and for all that you've done over the last 9 months as well to get us to this stage. Moving on then to our next story. The diversity of India necessitates community engagement at the local level through mediums that invoke trust, also to counter misinformation about COVID and the related vaccination drive. So from braving the steep climbs of the Himalayas to wading through severe floods, to reaching the remotest areas to serve tribal populations, the healthcare workers and the frontline workers, they've been adopting unique methods at local level, integrating these methods with established government as well as civil society networks to boost the vaccination drive. Here's our report.
India's diversity brings along several challenges with it, and the challenge becomes even bigger when it's related to the fight against a global pandemic such as COVID-19, during which all eligible people across the country have to be rapidly vaccinated. India's commitment and determination was clearly visible when the world's highest motorable village of Komik in the remote Spiti Valley of Himachal's tribal Lahore and Spiti district achieved 100% vaccination against COVID-19 for residents above the age of 45 years. Corona warriors have decided not to bow before the pandemic. These visuals from Arunachal Pradesh stand proof of it. Reaching the unreached, bringing COVID vaccines to remote communities. With this promise, a team of officers and doctors undertook a 9-hour arduous journey crossing mountain peaks and rivers. They administered COVID vaccine shots to 16 yak grazers in a remote village on the Himalayan heights in Arunachal Pradesh's Tawang district. The healthcare workers are leaving no stone unturned to ensure vaccination for all. Dedicated boats in Muzaffarpur in Bihar ensured COVID vaccination even in the flooded areas of the district. A large number of people left out of the vaccination drive due to inaccessibility and difficulties in reaching out to them. But the population living on remote islands in the middle of the sea in West Bengal's Sundarbans was facing a double challenge of cyclone Omphan and Yas and the COVID-19 pandemic. Irrespective of the high and low waves rising in the sea, health workers reached these islands and vaccinated 100% of the population there. With the sacred resolve to vaccinate all citizens of the country, healthcare workers continue to brave all odds, proving to be our heroes in the fight against the global pandemic. Bureau Report, DD India.
And the war against COVID-19 opened a battlefront across the globe, providing much-needed assistance. During these trying times, India initiated Vaccine Maitri, a diplomatic mission to supply vaccines to needy countries. And more than 95 countries were beneficiaries of the Made in India vaccines. Vaccine diplomacy offered India the opportunity to not only strengthen relations with these countries worldwide, but also to win the goodwill of people. Here's a report.
The entire world, including India, was struggling with COVID pandemic. While saving its population of more than 1 billion, India demonstrated its ancient philosophy of Sarvajan Hitaye, Sarvajan Sukhaye and Vasudhaiva Kutumbakam in the true sense, even in this hour of crisis. Whether it was about evacuating people of various nationalities from the place of origin of coronavirus, that is Wuhan, China, or sending chloroquine to the countries that needed it in their fight against COVID, or providing vaccine doses to other countries through Vaccine Maitri, while ensuring vaccination of own citizens, India has extended assistance to all the needy countries against this common enemy of mankind, with just one aim, that is to ensure that even the weakest countries can face this crisis faced by humanity with full force. India not only provided COVID vaccines to countries like Britain, America, Saudi and Canada, but also helped poor nations who were neglected during the times of crisis. Through the Vaccine Maitri initiative, which started on 20th of January this year, India exported over 6 crore 63 lakh COVID vaccines to more than 95 nations till May 29th. Around 70% of the total grant of COVID vaccines by India went to neighbouring countries including Bangladesh, Myanmar, Nepal, Bhutan, Sri Lanka and Maldives. India has provided vaccines to some African countries too. India has pledged a contribution of $10 million towards the SARC COVID-19 emergency fund. Following the announcement, India has also delivered medical supplies, test kits and sanitizers to Sri Lanka, Maldives, Afghanistan, Nepal and Bangladesh. Along with equipments, Rapid Response Team has also been sent to Nepal. Brazilian President Jair Bolsonaro tweeted a picture of Lord Hanuman carrying a mountain of coronavirus vaccine to Brazil while thanking Prime Minister Narendra Modi for helping his country with the vaccines. Under the Vaccine Maitri initiative, Prime Minister Narendra Modi began a chapter of vaccine diplomacy under India's foreign policy during these testing times. Through this, not only struggling countries got benefited from the assistance, but India also got an excellent opportunity to promote its foreign policy and diplomatic relations with the world. Bureau Report, DD India.
The Cabinet Committee on Economic Affairs approved the PM Gati Shakti National Master Plan. The project will greatly reduce logistics costs and will boost the economy. The Cabinet also approved additional dearness allowance to central government employees and dearness relief for pensioners. Let's look at the details in this report.
The Cabinet Committee on Economic Affairs on Thursday approved the Prime Minister Gati Shakti National Master Plan, including institutional framework for rolling out, implementation, monitoring and support mechanism for providing multimodal connectivity. Prime Minister Narendra Modi on October 13th launched the ₹100 crore National Master Plan to develop infrastructure to reduce logistic cost and boost the economy. Union Minister Anurag Thakur said a multimodal network planning group will be constituted with representation from the heads of the network planning division from various ministries and departments.
ये अपने आप में पीएम गति शक्ति योजना बुनियादी ढांचा योजना में इंटर मिनिस्ट्रियल और इंटर डिपार्टमेंटल कोऑपरेशन में इंफ्रास्ट्रक्चर प्लानिंग में गेम चेंजर साबित होगी और हमारा मानना भी है कि गति शक्ति विकास परियोजना के प्रति हमारे दृष्टिकोण में एक बड़ा बदलाव का संकेत देता है.
The Prime Minister Gati Shakti NMP will be monitored through a 3-tier system and will be presided over by an empowered group of secretaries headed by the Cabinet Secretary. The NPG will be assisted by a technical support unit in the Logistics Division of Ministry of Commerce and Industry with experts from sectors like aviation, maritime, public transport, rail, roads and highways, ports, etc. and subject matter experts from urban and transport planning, structures that includes roads, bridges and buildings, power, pipeline, GIS, ICT, finance, market PPP, logistics, data analytics, etc. The Union Cabinet, chaired by the Prime Minister on Thursday, also approved to release an additional installment of dearness allowance to central government employees and dearness relief to pensioners with effect from 1st of July 2021, representing an increase of 3% over the existing rate of 28% of the basic pay or pension to compensate for price rise.
47,14,000 केंद्र सरकार के कर्मचारियों को और 68,62,000 पेंशनर्स लाभान्वित होंगे. इस पर कुल खर्चा प्रतिवर्ष 9,488.74 करोड़ रुपए आएगा.
After the increase of 3%, the rate of dearness allowance of central employees has now gone up to 31%. The country was also congratulated during the cabinet meeting for achieving the 100 crore vaccination figure, an important milestone in India's fight against COVID under the leadership of Prime Minister Modi. Newsnight Desk, DD India.
In some news that's just coming in, a consensus decision has been taken by the FATF as Pakistan has not taken action against terrorist organizations on its soil, so it will remain on the grey list of the Financial Action Task Force, that's the FATF, under increased monitoring for non-compliance in one critical parameter of the 27-point action plan. Turkey has been grey-listed for the first time. Pakistan is yet to take action and prosecute designated terrorists. And for more news on the world, let's take a look at this report. Poland's clash with Brussels over a court ruling that questioned the supremacy of European Union law has been added to the agenda of the Leaders' Summit this week at the request of several countries that see it as a serious crisis for the bloc. A senior EU diplomat said 12 countries had asked for the matter to be discussed at the meeting in Brussels, in addition to the spike in energy prices and the COVID-19 pandemic. The United Nations has set up a special trust fund to provide urgently needed cash directly to the people's economy in Afghanistan through a system tapping into donor funds frozen since the Taliban takeover in August. The aim is to inject liquidity into Afghan households to permit them to survive this winter and remain in their homeland. Germany had pledged over 58 million to the fund and said that it is in touch with other donors to mobilize resources. Women and civil society activists protested in the Afghan capital, demanding that the Taliban respect their civil rights. The group marched in Kabul, holding signs advocating for women's participation in society as well as education and employment, and chanting, "We are deprived of our rights." In Spain, hundreds of people were evacuated from the Spanish island of La Palma during a protracted volcanic eruption. A total of around 7,500 people have been forced to flee since the Cumbre Vieja began erupting more than a month ago. Spanish scientists took samples of the red-hot lava from Cumbre Vieja volcano to check the viscosity of the semi-molten sample. Russia reported a record 1,036 coronavirus-related deaths in the last 24 hours, as well as 36,339 new infections, a surge that has seen some health restrictions reinstated. Moscow's mayor has announced 4 months of stay-at-home restrictions for unvaccinated over 60s. The city will introduce lockdown measures from October 28, with supermarkets and pharmacies to remain open. Storm, rain and wind gusts caused damage and major travel disruptions across Germany on Thursday. The German Weather Service issued a severe weather warning for large parts of the country, with especially strong winds dubbed as Storm Ignaz. Expected in the central strip across Germany. Wind gusts of over 100 kilometers per hour were expected, according to the DWD. The Union Home Minister Amit Shah visited the rain-hit areas of Uttarakhand and conducted an aerial survey. He took stock of the situation with the governor and the chief minister, and he reviewed the administrative measures with state and central officials. Meanwhile, the rains continue in Kerala, with the IMD issuing an orange alert there for 8 districts in the southern state.
Union Home Minister Amit Shah on Thursday conducted an aerial survey of the rain-hit Garhwal and Kumaon divisions of Uttarakhand. He took stock of the situation in Devprayag, Pauri, Ramnagar, Ramgarh, Rudrapur and Haldwani. After an aerial survey, the Union Home Minister held a review meeting with the state and union officials and gave them necessary instructions. He said the centre had alerted the state in advance about the disaster, resulting in minimal loss of life and damages in the state.
राज्य सरकार और केंद्र सरकार के उच्च स्तरीय अधिकारियों के साथ भी बैठना हुआ। पूरी समीक्षा भी की गई। एक बात ये सुनिश्चित निकल कर आई कि भारत सरकार की ओर से समय पर चेतावनी मिलने के कारण बहुत कम मात्रा में नुकसान हुआ है।
The Union Home Minister said that from the very first day of the disaster, PM Modi instructed officials to control the situation. The centre sanctioned 250 crore rupees to Uttarakhand for post-disaster relief. He lauded the efforts of Chief Minister Pushkar Singh Dhami for disaster management.
मुख्यमंत्री जी के नेतृत्व में पूरा राज्य का प्रशासन रेस्क्यू के लिए लगा और इसके कारण बहुत लोगों की जानों को बचाया गया है।
Relief and rescue works are going on in the state on a war footing after improvement in weather conditions in Rurapur, Dharma Ghati and Beas Ghati of Dharachula. Evacuation of stranded passengers resumed with the help of Air Force helicopters.
हमने एक चिनूक जो है आर्मी का हेली वहां भेजा है गुंजी, उसमें भी 30 लोग जो है रेस्क्यू हो गए हैं, वो पिथौरागढ़ पहुंचने वाले हैं और इस प्रकार से जगह-जगह जहां भी लोग फंसे हुए हैं उनको हम निकालने की कार्रवाई कर रहे हैं।
In the meantime, the Meteorological Department has issued an orange alert for heavy rains till the 25th of October for 8 rain-hit districts of Kerala. These districts are Pathanamthitta, Kottayam, Idukki, Palakkad, Malappuram, Kozhikode, Wayanad and Kannur. At the same time, a yellow alert has been issued for the remaining districts. A warning has also been issued to fishermen not to venture into the sea. On 15th and 16th October, heavy rains and landslides had claimed 42 lives in Kerala. Bureau Report, DD India.
News snippets from across the country in News at a Glance.
Prime Minister Narendra Modi inaugurated the Infosys Foundation Vishram Sadan at the National Cancer Institute in the Jhajjar campus of AIIMS New Delhi via video conference. He noted that today in AIIMS Jhajjar, patients coming for cancer treatment have got a great convenience. He said Vishram Sadan built in the National Cancer Institute will reduce the worries of patients and their relatives. The Supreme Court has asked farmers' unions to respond to a bunch of pleas seeking removal of roadblocks on the Delhi borders by the 7th of December, the next date of hearing. The apex court said roads cannot be blocked and there should be no doubt about this. Notices have been issued to 43 farmer unions, but only 4, including the Bharatiya Kisan Union, have registered their presence. A special court in Mumbai extended the judicial custody of Aryan Khan and 7 others till the 30th of October. Meanwhile, actor Ananya Pandey along with father Chunky Pandey appeared before the NCB office and was questioned in the cruise ship drug raid case. Ananya Pandey has been asked to appear before the agency tomorrow at 11 a.m. Police Commemoration Day was observed across the country. The main parade was held at the National Police Memorial in New Delhi. While addressing the function, Minister of State for Home Nityanand Rai said that India will never compromise on its sovereignty and security. Minister of State for Shipping, Ports and Waterways Shantanu Thakur concluded his visit to Pahalgam in Jammu and Kashmir. He laid the foundation stone of a 500 LPM oxygen plant at Sub-District Hospital in Achabal. Union Home Minister Amit Shah will visit Jammu and Kashmir from tomorrow to take stock of the law and order situation in the Union Territory. He will be there in the Union Territory for 3 days. He will review important projects, including the Prime Minister's development project in Jammu and Kashmir. He will also hold a meeting of the Unified Command in Srinagar.
Well, that concludes News Night for tonight, but we leave you with these images and music of key monuments in the country that have been lit up to celebrate the milestone of India's crossing 100 crore vaccinations. Thanks for watching. Namaskar.
100 crore COVID vaccination in India. Thank you very much, sir. Thank you very much.
सबका साथ सबका प्रयास है, भारत का टीकाकरण लिख रहा एक नया इतिहास है। मेरे देश को विश्वास है, सबका साथ सबका प्रयास है, भारत का टीकाकरण लिख रहा एक नया इतिहास है। शतकोटि गर्व एहसास है, ये एक नया इतिहास है, इतिहास है। शतकोटि गर्व एहसास है, ये एक नया इतिहास है, इतिहास है। धन 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 धन।
100 करोड़ वैक्सीनेशन के साथ आज भारत लिख रहा एक नया इतिहास है।